From your path and in all these education you provided, what do you think are some of the most important tips that you can give people?
Thank you, Dr. Joy, and thank you for having me. For me, honestly, the health space has been a passion since I was 16 years old. I had a dream that I wanted to be a doctor, and ever since then, I really started getting involved in understanding how our body heals. And that led me to become a doctor of chiropractic and an acupuncturist, an energy medicine doctor, a nutritionist, and really began this whole path that most conditions that we're struggling with right now can actually be prevented. And I think we should start there, because the mindset of most of us out there in the world is that we have to learn to live with our illnesses. And what we have found in the holistic world is that there are many ways that one can actually reverse an illness or maybe even completely heal an illness, but it's not your conventional methods. It's not going to be a pharmaceutical drug. It's not going to be perhaps even a surgery, but it's going to be changing a little bit the mindset behind how you see that illness in your life. And also the behaviors, we call that lifestyle, that may be the root cause of that problem.
Yeah. So, I mean, this is why functional medicine, even though the traditional medical route, all the doctors are still kind of poo-pooing it. They don't think it's real science, even though it's based on so much research and very, very active research from all around the world. Even with all the oppositions, it's growing at I think exponential speed. You've been in this field for a long time, and what have you seen as far as the growth of this whole new way of doing health?
Well, it's interesting because yesterday I was interviewed by one of the leading medical doctors in Dallas, Texas. He's an internal medicine doctor, and his father and his mother come from a healthcare perspective, all in the traditional medical way. And all of a sudden, he became one of the leading doctors in Dallas, not because he was a traditional medical doctor, but as an internist, he was able to actually discover through functional medicine, through hyperbaric, chambers, which are just bringing the oxygen back into our cells, which is so important for our opportunity to heal, and many others. And I asked him that question. I said, as a traditional doctor, why did you change? And why is it that many of your colleagues are still stuck in what they were taught in school? And he said, it's interesting you asked that, because for me, I wasn't getting results in some of the conditions that I was treating. And I am obsessed in helping my patients. And I would look at the science and I would see that there was out there things that we were not being reminded of in our conventions. We were not being taught in our continuing education. So I had to go outside of the box. And that's the way he said it. I had to go outside of the box to actually find where some of these techniques were, some of these technologies, some of these services that are allowing my patients to actually heal from things that I couldn't even begin to help heal 10 years ago, 15 years ago. So I think that both for providers, we need to be, just really open-minded and recognize that our oath is to support our patients no matter what. And if you have to stay open because the world is changing so rapidly and things and technology and services are coming in, that many of us are just stuck in the way we do business and do medicine and are not open. And then for the consumers, I think it's very important that you don't rely only on one provider for potentially what could be some of the things you could be doing to help yourselves. For years, 30 years that I've been, over 30 years a provider, how many patients have come to me and said, why did my medical doctor did not tell me about this? Or why did anyone out there tell me that there was something that could help alleviate my suffering? And here I am been suffering for 15, 20 years, and nobody ever told me that there was this available. So I think open-mindedness is the key to be able to recognize that there is a science that is holistic, that is non-threatening, but the difference is that science is not trying to manage symptoms. that science is really obsessed with identifying what got us sick in the first place. And I have found in my 35 years of being a provider, and that is two things, honestly, Dr. Joy. It is the way we think. Our thoughts are very toxic. In fact, the new science have said that the average person has over 70,000 thoughts a day. 90% of those thoughts are the same thoughts we had the day before. So we're repetitive in nature. But hear this, 80% of those thoughts are negative in nature. So mentally, we're very toxic. We're thinking negative thoughts. We are looking at the half empty glass rather than the half full glass. We're not looking for things that are working. We're actually becoming victimized for things that are not working. So we need to shift our attitudes a little bit. And then second, we realize that when the discovery of epigenetics, and for those of you that have never heard the words, for many years in science, we have looked at genetics. Those are the genes that are inside your cells. And scientists were saying that they determine about 80% of who you become in life. So if your parents had an illness and their parents had an illness, the chances that you were going to get that illness was very high. Well, today we know through epigenetics that the environment around the cell, which is our lifestyle, what we do in our lives every day, is what determines whether that gene is going to activate itself or not. And most scientists are saying that only 10 to 15% of your genes determine your future. So even if your parents had diabetes and your grandparents had diabetes, now by changing your environment, what we eat, how we structure our lives, the stress levels that we have, all of those things now you can maybe be the one that breaks the change of diabetes in your family so your children can have a better future. So epigenetics have really taught us that our environment, the things that we do on a daily basis, is what really is determining the health of Americans today.
Wow, that's extraordinary. Going from what we thought was 80% down to 15 to 20%. I mean, that is so mind-opening and